Nicholas A. Christakis, Apollo's Arrow, The Profound and Enduring Impact of Coronavirus on the Way We Live. Embark on a journey through the profound and enduring impact of the coronavirus pandemic as we explore the key highlights of Apollo's Arrow, The Profound and Enduring Impact of Coronavirus on the Way We Live by Nicholas A. Christakis. Discover how SARS-2, a new strain of coronavirus, originated from a wet market in Wuhan, China, and rapidly spread across the globe. Through various scenarios, we'll examine the unique qualities that make SARS-2 so devastating, the significance of non-pharmaceutical interventions, and the unpredictable nature of its consequences. By understanding the critical aspects of this pandemic, we can better prepare ourselves for the future.
The Unraveling of SARS-2. On December 26, 2019, Dr. Jixin Zhang from Hubei Provincial Hospital in Wuhan, China, noticed an alarming increase in severe acute respiratory syndrome, SARS, cases. Despite initial reluctance from Chinese health authorities, schools and businesses were eventually closed in an effort to control the outbreak. By January 27, the Chinese Center for Disease Control singled out the cause, a novel coronavirus named SARS-CoV-2 or SARS-2. It is believed to have originated in bats and first infected people at Wuhan's Huanan seafood wholesale market. The virus mutated, allowing for swift human-to-human transmission, causing the potentially fatal disease COVID-19. With varied symptoms including fever, cough, fatigue, and anosmia, COVID-19 affects each person differently. Some experience severe respiratory symptoms or even death, while others show no symptoms at all. The virus has spread globally, with governments imposing strict control measures as citizens adapt to the ongoing threat. As of July 1, 2020, over 1 million people have succumbed to the disease worldwide, and no end is currently in sight. The ideal pandemic catalyst. At 107 years old, Marilee Shapiro Asher came face to face with COVID-19, a century after surviving the Spanish flu. This reminds us that new viruses are constantly emerging, and humanity must always be prepared. SARS-2, the virus responsible for COVID-19, has the perfect qualities to fuel a sustained pandemic, a lower fatality rate, a high reproductive rate, and a long period of subclinical infectiousness. These factors combine to make it stubbornly challenging to contain. When Marilee Shapiro Asher found herself battling COVID-19 in April 2020, her 107-year-old body had already outwitted another historic virus, the Spanish flu of 1918, over a century earlier. Her resilience is a testament to the endurance of the human spirit, but also a sobering reminder that we must always be vigilant against new viral outbreaks. Every once in a while, we encounter a virus that is particularly difficult to manage, like SARS-2, the catalyst for COVID-19. Why is it so effective at creating a sustained pandemic? While there are multiple coronaviruses circulating among humans, most cause only mild colds. However, the emergence of SARS-1 in 2003 led to a swift and deadly outbreak worldwide. SARS-1 eventually fizzled out, but SARS-2 endures. There are a few key reasons for this tenacity. Firstly, SARS-2 is not as lethal as its predecessor. A virus's lethality is measured by its case fatality rate, CFR, which calculates the probability of death following infection. SARS-1 had a CFR of 10%, meaning it often killed its hosts before they could infect others. In contrast, SARS-2's CFR sits around 2%, allowing infected individuals to continue spreading the virus. The virus's reproductive rate, R0, also plays a significant role. This crucial statistic estimates the average number of people one infected person will pass the virus on to. With a much higher R0 of 2 to 3 compared to SARS-1, SARS-2 is far more contagious, making it tough to control. Finally, SARS-2 boasts a lengthy period of subclinical infectiousness, meaning that people are contagious long before symptoms appear. While SARS-1 patients could only infect others after displaying symptoms, SARS-2 carriers can unknowingly spread the virus for over a week prior to realizing they're ill. This sneaky characteristic further complicates efforts to contain and prevent its transmission. In the ongoing battle against COVID-19, understanding the potent qualities of SARS-2 is vital for effectively addressing this global health crisis. It is through such knowledge that we can hope to better manage and, ultimately, overcome the challenges of future pandemics. Pandemic control through behavior. The history of disease control reveals that improvements in sanitation and non-pharmaceutical interventions, NPIs, often play a crucial role in reducing death rates. During the COVID-19 pandemic, NPI strategies like lockdowns, mask wearing, and contact tracing have helped slow the virus's spread and save lives. Embracing these simple yet effective protective measures highlights the significance of behavioral changes in our fight against pandemics. Long before the development of drugs like penicillin, isoniazid, and chloramphenicol, the death rates from diseases like measles, scarlet fever, typhoid, and tuberculosis had already been declining. A closer examination of this trend reveals that the simple introduction of basic sanitation measures, such as handwashing and access to clean drinking water, were responsible for these public health success stories. These non-pharmaceutical interventions, NPIs, prove that we can slow and stop pandemics by changing our behavior. The COVID-19 pandemic has highlighted the power and importance of NPI strategies in controlling disease transmission. In the early stages of the pandemic, when a vaccine was not yet available, health authorities prioritized lowering the virus's reproductive rate. By reducing infection rates and slowing the pace of spread, society could better manage the crisis, leading to the well-known goal of flattening the curve. The implementation of NPIs became essential in achieving this outcome. Lockdowns, one of the main NPIs applied in the United States, involved closing schools, businesses, and public gathering places. At its peak, Americans spent 93% of their time at home, according to the Washington Post. While these measures effectively reduced virus transmission, they also had substantial economic impacts, with unemployment rising above 15% by May. In addition to lockdowns, mask wearing emerged as another powerful NPI strategy. Although initially discouraged due to concerns about supply shortages for medical professionals, the practice eventually became widespread. By April, 75% of Americans reported using masks outside the home. Simply wearing a cotton mask can reduce the distribution of viral droplets by up to 99%, which greatly helps in controlling the spread of the virus. For individuals who do contract COVID-19, contact tracing is another effective NPI. This process involves identifying and quarantining everyone who has come in contact with an infected person. While this method is time-intensive and could require up to 300,000 workers in the United States alone, it has proven crucial in slowing the virus's spread. In conclusion, non-pharmaceutical interventions, although often understated or overlooked, hold immense power in controlling and preventing pandemics. By adopting these simple behavioral changes, we can create a significant impact, contributing to the overall protection of public health. Fear and lies worsen pandemics. The coronavirus pandemic has been aggravated by fear, misinformation, and lies, which have emotional and physical ramifications on society. The distress brought about by the illness, coupled with financial and personal struggles, drives people to seek scapegoats and latch onto conspiracy theories. Deliberate spread of misinformation by certain officials and profiteers exploits the vulnerability of the general public and leads to dangerous behaviors, further exacerbating the situation. Wanda DeSalle, a California nurse, succumbed to COVID-19, and her family mourned her passing via video call due to the contagious nature of the virus. When Dr. Richard Levitan, a New Hampshire physician, traveled to Manhattan to aid overwhelmed hospitals, he faced fear-driven discrimination from his brother's landlord. Meanwhile, Texan media personality Alex Jones shamelessly sold a bogus cure as the death toll soared. These stories hold the same thread: fear and lies aggravate pandemics. The psychological ramifications of pandemics have long-lasting effects. Surveys reveal a significant decrease in joy and a simultaneous increase in worry, sadness, and anger following the emergence of SARS-2. These complex emotions stem from grief, fear of infection, loss of livelihood, and the never-ending search for a solution or someone to blame. As a result, conspiracy theories proliferate. Nearly a third of Americans believe in the false claim that the virus was purposely designed in a laboratory. Worse, some officials have exploited the situation for their own interests. The Trump administration downplayed the threat, reprimanding CDC officials for suggesting the virus could spread to the U.S., despite evidence showing rising infections and deaths. These factors shape the public's response, producing dangerous behaviors. Many people have ignored the risks, attending crowded events and contributing to the disease's spread. In contrast, others have acted on unsound medical advice, leading to tragic outcomes. In conclusion, the effects of a pandemic extend far beyond the disease itself. As fear and lies suffocate the truth, society's emotional turmoil deepens, and the crisis worsens. Honest communication and accurate information are vital in fighting both the virus and the unfortunate consequences of fear and falsehoods. Pandemic exacerbates social divisions. The outbreak of COVID-19 has intensified existing social inequalities in America. People from different backgrounds experienced contrasting challenges in the face of this crisis. The impact of the pandemic is far from evenly distributed, with marginalized communities facing the worst outcomes, including racial disparities in infection rates and mortality statistics. This is linked to a variety of factors such as uneven socioeconomic status, in-person job requirements, lower pay, and inadequate health coverage, all of which contribute to chronic health issues. However, amidst these divisions, the pandemic has also sparked instances of social solidarity. Imagine yourself as a successful white-collar professional residing in Manhattan. When the pandemic strikes New York City, you have the luxury to retreat to a summer home up north and continue working remotely. Moreover, your comprehensive health insurance ensures you access to the best care in case you fall ill. Now, picture yourself as an underprivileged janitor from Queens. When faced with the threat of the virus, you're stuck choosing between the risk of infection at work or financial ruin in a cramped apartment you share with vulnerable family members. Unfortunately, for vast numbers of Americans, the latter situation is closer to their reality. Though it may seem that viruses indiscriminately inflict suffering, the fact is that diseases like SARS-2 make existing social inequalities even more apparent. Certain sections of the population, such as the elderly, are more susceptible to the virus, while men tend to have higher fatality rates than women due to differences in overall health. Marginalized communities bear the brunt of the pandemic, with racial disparities evident in both infection rates and mortality statistics. In the United States, Hispanic and Black Americans are 3 times more likely to contract COVID-19 and twice as likely to die from it compared to white Americans. Similarly, low-income and disadvantaged Native American communities have experienced some of the most severe outbreaks. The discrepancies stem from unequal socioeconomic statuses across diverse groups. Racial minorities often hold jobs requiring in-person labor, which increases the likelihood of exposure to the virus. Moreover, such positions typically offer low pay and lack health coverage, factors that exacerbate chronic health problems like diabetes, hypertension, and cardiovascular disease. In turn, these pre-existing conditions multiply the risks associated with COVID-19. Despite these stark social divisions, the pandemic has given rise to instances of solidarity and unity, as people across the country come together to support one another in these difficult times. Altruism amid pandemic. When Yale University canceled in-person classes in March 2020, undergraduate Liam Elkind saw an opportunity to help others. Alongside his friends, he created Invisible Hands, an organization aimed at delivering groceries and essential supplies to elderly residents in Manhattan. This initiative quickly attracted thousands of volunteers, evidencing that the pandemic has brought out our altruistic tendencies. Many similar mutual aid organizations sprung up across the country, addressing various needs such as food, shelter, childcare, and mental health services. Remarkably, by May 2020, 37% of Americans had donated their time, resources, or money to aid organizations. Research shows that people demonstrate acts of kindness during disasters, prioritizing the needs of others above their own. A study examining the effectiveness of public health messaging found that people are more inclined to change their behavior when the messages focus on protecting the well-being of others rather than themselves. This selflessness is particularly evident in the dedication and courage displayed by healthcare workers during the pandemic. Despite limited personal protection equipment, they improvised with makeshift supplies and continued to save lives, risking their own safety. The collaborative spirit is also evident in the global quest for a vaccine. Researchers worldwide are sharing information to expedite drug development. Additionally, individuals have volunteered for the risky task of testing new drugs, with over 1,500 people signing up for trial vaccines by April 2020. The pandemic has undeniably ignited a unique wave of altruism, encouraging people to work together and support each other through these challenging times. Pandemic's ripple effects. The COVID-19 pandemic rolled out a massive wave of change that rippled through every corner of society, creating unprecedented shifts in our daily lives. It quieted the Earth's seismic activity as human activity momentarily took a back seat and accelerated transformations in how we interact with one another, embrace technology, and reprioritize our values. The pandemic had far-reaching consequences on people's daily lives, evident by the seismic tranquility detected by sensitive equipment at the Royal Observatory of Belgium when Europe went into lockdown in March 2020. The cessation of human activity had momentarily made the Earth quieter, revealing the incredible scale of the disruption. In mere months, the novel coronavirus altered our collective experiences. Churches and concert venues turned silent, while hospitals and funeral homes faced overwhelming numbers. Fuel demands decreased, causing falling oil prices, and liquor sales hit a record high. Swiftly, the pandemic introduced changes that would impact our lives in diverse ways. Social dynamics shifted dramatically with transformations in how we communicate. Masks have become necessary accessories, and traditional handshakes now seem unimaginable. As time goes on, these changes may become ingrained in our interactions, with distant gestures like bows taking their place. Technology advancements, while enabling virtual schooling and teleworking, have ignited concerns about surveillance and privacy. Facial recognition and eye-tracking technologies now oversee many students taking exams, and employers utilize similar methods to track employees' productivity. The unsolicited storage and sale of data by tech companies also raise ethical questions. The pandemic's ripple effects continue to alter our evolving world. Cities are designating car-free zones, making way for pedestrians, while wealthier individuals migrate from urban centers to quieter rural areas. Essential workers, fueled by a heightened sense of importance, are increasingly advocating for their rights and recognition. There is no crystal ball to predict exactly how these changes will influence our future, but there's no doubt that the COVID-19 pandemic has left an indelible mark. The world, reshaped by a virus, will never be the same as we once knew. The unpredictable future of pandemics. The late 1880s experienced a devastating plague that began in Bukhara and spread to Europe and America, ultimately transforming into the common cold virus OC43. Similarly, the SARS-2 pandemic may have various outcomes, as its future trajectory remains uncertain. Herd immunity, virus mutation, or increased genetic resistance among humans could shape how the pandemic plays out. Ultimately, overcoming a pandemic involves a massive societal effort to make everyone feel safe in returning to their normal lives, as future pandemics may be lurking. In the late 1880s, a crippling plague emerged from the remote city of Bukhara in present-day Uzbekistan. This rampant disease soon spread across Europe and America through newly established rail lines, leaving a horrifying death toll of 250,000 people in its wake. Interestingly, the suspected pathogen responsible for this plague was OC43, a coronavirus variant. Today, this virus merely results in a common cold. Drawing parallels between OC43 and the current SARS-2 outbreak, we may see a similar transition. The pandemic could reach its end, but the virus might remain among us. Predicting the course of the SARS-2 pandemic is challenging, but educated guesses point towards a few potential scenarios. One possible outcome is herd immunity, established either by a successful vaccine or by approximately 70% of the global population contracting COVID-19. Another foreseeable scenario is the mutation of the SARS-2 virus into a less lethal strain, following a similar evolutionary path as OC43. Furthermore, the human body can adapt to viral threats. Certain genetic variations may grant individuals resistance to particular diseases. Over generations, natural selection could favor these traits, leading to higher resistance or even immunity in our descendants. In the past, this evolutionary dynamic has been observed in malaria-ridden regions, where populations display increased resistance compared to their European counterparts. Beyond biochemistry, the true measure of conquering a pandemic lies within the realm of society. Life normalizes only when even the most vulnerable community members feel safe re-engaging in day-to-day activities. Achieving this level of security requires immense collective effort and support for all members of society. As the world continues to grapple with the ongoing pandemic, it is crucial to recall that the next potential outbreak may be just around the corner. Proactive measures and adaptability must remain at the forefront to tackle any future challenges posed by such pandemics.
In conclusion, Apollo's Arrow provides a comprehensive examination of the far-reaching consequences of the SARS-2 pandemic, from its rapid spread to the variety of responses by governments and the general public. From the social divisions it exposes to the newfound sense of community and collaboration, our world has been permanently altered by this virus. While the future remains uncertain, we can draw hope from this book and work together to build a better, more resilient world in the face of pandemics. Ultimately, we must be prepared for the next major outbreak, learning from the mistakes of today and the lessons revealed in Apollo's Arrow.